This video is intended for patients who have been prescribed latisse. It is not for circulation to the general public. Thank you for purchasing latisse from Allergan, a pharmaceutical leader with more than 60 years of eye care expertise. This video will share the scientific research behind latisse and how latisse, when used correctly, can benefit you. Introducing latisse. Latisse active ingredient bimetoprose 0.3 mg per milliliter is the first and only Singapore-registered FDA-approved treatment for hypotrichosis, a condition for inadequate lashes. It is available by prescription only. Eyelash growth cycle. A regular eyelash life cycle occurs in three main phases. In the first phase, the eyelash will grow actively. Each lash grows up to a certain length and stops. This means that the longer the growth period, the longer your lashes will be. In the second phase, the new eyelash growth slows down and eventually stops, triggering the third and last phase. In this phase, the newly formed eyelash stops growing as it has reached its full potential length. With time, the eyelash slowly weakens and the old eyelash is pushed out by the new eyelash, giving it room to grow and lengthen. When this happens, the growth phase restarts. How latisse helps. Your lashes are genetically programmed to only grow up to a certain length before it stops. But with latisse, the first phase is prolonged and the transition from resting to growth phase is also stimulated, thus allowing the new hair shaft a longer period for growth, resulting in longer eyelashes. Results. A latisse research with users shows an average of 25% improvement on eyelash length when compared to non-latisse users, 106% improvement in thickness, and an 18% increase in darkness. In fact, participants treated with latisse have a high satisfaction rate with their eyelash growth results. A significant improvement in eyelash appearance was noticed as early as 8 weeks, with full results in 12 to 16 weeks. Proper use and care. Latisse is a prostaglandin analog used to treat hypotrichosis of the eyelashes on the upper eyelid in adults by increasing their growth in length, thickness, and darkness. Discontinued use will gradually return eyelashes to their previous appearances. Safety and efficacy of latisse in the treatment of hypotrichosis beyond 16 weeks have not been investigated. If you experience any eye problems or have had eye surgery, consult your doctor. How to apply latisse. Once nightly, start by ensuring your face is clean. Makeup and contact lenses are removed. Your latisse product comes with a full set of sterile applicators. First, remove an applicator from its tray. Then, holding the sterile applicator horizontally, place 1 drop of latisse on the area of the applicator closest to the tip, but not on the tip. Now, close the eye which you are going to apply latisse on. Then, immediately draw the applicator carefully across the skin along the base of the upper eyelid margin at the root of the eyelashes. This is the area where the eyelashes meet the skin. Gently remove any excess solution beyond the eyelid margin. If the solution gets into the eye, it is not expected to cause harm and you should not rinse your eye. Dispose of the applicator after one use. Repeat this process for the other eyelid using a new sterile applicator. This helps minimize any potential for contamination from one eyelid to the other. Frequently asked questions. Should I remove my contact lenses first? As a precaution, it is recommended that you remove your contact lenses because they can absorb an ingredient in latisse. However, you can put them back on in 15 minutes after application. What if I missed 1 or more applications of latisse? If you missed a dose, do not try and catch up by applying latisse twice a day. Simply apply latisse the next evening and stay on course. It is important to note that using latisse more than once a day will not increase the growth of your eyelashes. How can I avoid missing a dose? Just like other nightly skincare regimes, such as removing makeup or applying moisturizers, consistency is important when applying latisse for results. Therefore, it is important to make latisse part of your nightly routine. What should I do if latisse gets in my eye? It is not expected to cause harm, so there is no need to rinse your eye. To avoid contamination, be careful to keep the tip of the bottle or applicator from touching your fingers or other surfaces. What if I stop using latisse? Your eyelashes are expected to return to its previous appearance over several weeks to months. How soon can I see the results? Significant results may be seen in as early as 8 weeks with dramatic effects in 12 to 16 weeks. Eyelash growth is gradual over time. Once you begin treatment, you must continue to apply latisse every night and follow the application instructions for best results. Can I use cotton swabs or other cosmetic brushes to apply latisse? No. This is because latisse solution should only be applied gently with the US FDA-approved sterile applicators provided in your latisse kit.